Hi, everyone. It's Nassau County Executive Laura Curran, and you've got a treat tonight. I'm going to speak very briefly because we've got a panel of amazing doctors and medical professionals to talk about the vaccine. And we really want to speak to the Asian community tonight. We want to get your questions. We're going to speak, and then we're going to have a lot of questions from you who are out there watching. You can just type them in the messages below. I'm just going to, first of all, thank Farah Mazawala, who is our Executive Director of the Office of Asian American Affairs here at Nassau County, for putting this together. She and her team have done a great job. I want to thank Dr. Andrea Alt-Brutus, who is our Director of Health Equity with our County Health Department, who has been nonstop. She came on board here a few months before the pandemic started, and she has been fantastic, making sure that we're reaching all of our communities, getting information out throughout the pandemic and so many other things as well. So before I turn it over to Farah and everyone else, I just want to thank Dr. Leong, Dr. Park, Dr. Sati, and Dr. Chowdhury. Dr. Chowdhury, along with being a medical professional, is very involved with the Islamic Center of Long Island as well. So thank you, women, doctors, ladies, for being here, for taking time away from your families and from your very important work to share information with our counties. And before we get started, I just want to take a moment. I want to pause and acknowledge the horrific events in Georgia last night, the shootings that happened that appear to target Asian women. We have no tolerance for hate crimes or crimes at all here in Nassau County. On Sunday, more than 300 members of our community came together to stand up and say no to anti-Asian hate crimes. We're seeing some disturbing things around our country. We want everyone to know, I want to empower you. If you are the victim of something like this, you hear about something like this, there's any suspicions, please call 911. We're intensifying patrols in certain areas, and we want you to know that you are respected and protected here in Nassau County. We take that very, very seriously. Just want to shift gears a little bit now and talk about vaccination. We're doing really well in terms of getting doses in arms in Nassau County. More than 28% of our residents have had at least one dose. That's really good news. It's also more than any other large county percentage-wise in the state. Our Department of Health, Dr. Brutus, and the entire team, along with Northwell and Mount Sinai South Nassau and NYU Langone and NUMIC, who's helping us vaccinate our veterans, and the Catholic hospitals are really doing wonderful work, and we're going to keep it going. We're getting to the point now, as we get more supply of the vaccine, we really want to discuss people who are hesitant, the hesitancy to get the vaccine. There's some disinformation out there. There are some rumors that have blossomed. We want to arm you, no pun intended, with the facts so that you can make an informed decision when it comes time to roll up your sleeve. Eligibility is opening up. The amount of doses and places of distribution are opening up. So it's really important for you to become aware of the facts of this. I also want you to know that we have a special phone line for senior citizens opening tomorrow. We know that it's difficult for seniors to navigate the web sometimes. So if you're a senior or you know someone who is a senior who needs help getting an appointment, I'll give you the number. Starting tomorrow morning at 9 a.m., it's 516-229-9590, 229-9590. And I will turn it over to Farah Mazawala now, who is Executive Director of the Office of Asian American Affairs in Nassau. Thank you.
Thank you, County Executive, for those wonderful words. You know, the horrific news of the mass shootings in Georgia was extremely unsettling to the community. Thank you for your comments and remarks about it. Thank you. Thank you everyone for joining us tonight. Tonight, the Office of Asian American Affairs and the Department of Health Equity, the Department of Health, the Office of Health Equity is excited to host this panel where we're going to discuss the COVID-19 vaccine, the vaccine and the misinformation surrounding the vaccine. The Office of Asian American Affairs is excited to collaborate with the Office of Health Equity. Part of the mission of the Office of Health Equity is to let people from marginalized communities gain access to vital information that would otherwise be hard to get. We at the Office of Asian American Affairs have been working hand in hand with the Office of Health Equity on this for the vaccination for the Asian community. Two of the biggest obstacles to accessing accurate information about the vaccine is a lack of cultural understanding and language barriers. Our office is working diligently to address the needs of the Asian community. I want to thank the Department of Health, and I especially want to thank Dr. Albrutis, who is helping us put this panel together. She is the director of the Office of Health Equity, and thank you for all that you do for the community. Dr. Albrutis.
Thank you so much, Farah, and thank you so much once again for joining us for this really important conversation targeted towards the Asian community. I want to make sure that we provide the community with information about the COVID vaccine so that you can make the best decision for yourself and for your family and for the community. We have an amazing lineup of panelists, all women tonight, which is fantastic. I love that. Who's going to be giving information about the vaccine and addressing anyone's concerns about the vaccine. And we're going to allow for questions and answers towards the end of this webinar. So if you have any questions, please write them down and type them in the chat so that we can then ask our amazing panelists to answer those questions. So before we begin, I want to go and talk and introduce our amazing panel. So first we have Dr. Isma Chaudhry. She's the Director and Executive in Residence, Graduate Public Health Programs at Hofstra University, New York, and spokesperson, past president, and chair of the Islamic Center of Long Island. She's also the co-chair of the Long Island Health Equity Task Force, and we'll ask her to say a few words on behalf of the task force before we dive into the panel discussion. We also have Dr. Farhana Sati, internal medicine infectious disease expert at Mount Sinai, Queens. Dr. Isabella Park, Associate Medical Director, Director of Palliative Care, Long Island Jewish Forest Hills. And Dr. Liana Leong, Medical Director, Render 360, Render Physicians. Thank you so much for all of you for being a part of this really important panel. And before we begin and talk about COVID and the vaccine, I'd like for Dr. Chaudhry to say a few words on behalf of the Health Equity Task Force.
Thanks so much, Dr. Brutus, and thank you, Ms. Mozawala, for having me here today. And my esteemed co-panelists, thank you so much. I'm honored to be a part of it. A little bit about the Health Equity Task Force. So COVID has a lot of things, and one of the important things that we have learned is the collaboration between all people involved, the communities, the state, the county. Nassau County Department of Health has been an amazing support and partner, and then the health systems. So this actually came out of the conversations where we felt that certain needs of the communities were not translated and understood well by the care providers, and a lot of times by systems that are there. So Health Equity Task Force basically has two areas of work or subcommittees. One deals with information and outreach, and the other one is a community liaison. So we are a collaboration between community partners, houses of worship, and what we address is hesitancy, understand why there are certain barriers to, in this situation, vaccination, how we have to, important it is to identify the vulnerable communities. We cannot identify the vulnerable communities unless we have a partnership with those communities and we understand that what are the constraints, what are the limitations, what are the challenges of that community. For example, digital literacy. How to address that. With COVID, we found out that, we assumed that everybody would go on a computer and try to book themselves a vaccination spot. But then there is not a lot of digital literacy, especially in our senior populations. So basically this task force comes together bi-weekly, addresses these issues, comes up with solutions with subject matter experts and the community partnerships. Thank you.
Thank you so much, Dr. Chaudhry. And I'm a part of the Health Equity Task Force and FARA as well. And we have to say that the members of the task force are doing amazing work ensuring that we have equitable access to the vaccine and educating the public on the importance of getting the vaccine. And so speaking of the vaccine, we'll dive right on into the topic to talk about the vaccine and just understanding what various vaccines are out there and what's the biology behind the vaccine. We'll start with Dr. Sati to talk about, well, what are the various COVID-19 vaccine options? And can you talk a little bit more about the efficacy of all three options of the vaccine?
Thank you so much, Dr. Albrutus, and thank you for having me here. So I would like to talk about the vaccine. I'm sure that people know a lot already, hearing from the media and news, but just to go and review it again, there are three vaccines that have been authorized for use in United States. Pfizer and Moderna was authorized in December, and we recently got Johnson & Johnson authorized this month. Pfizer, as we know, it's a 2-dose vaccine which are given 3 weeks apart, and it's known to have an efficacy of 95%. And Moderna is a 2-dose vaccine, and Moderna and Pfizer is both are messenger RNA vaccines. And Moderna has a 94.5% efficacy after giving 2 doses, which are 4 weeks apart. And Johnson & Johnson is a adenovirus vector vaccine. And it has an efficacy of anywhere between 66 to 74%. These three vaccines are very effective, and they are, regardless of the vaccine, all three vaccines have basically are known to prevent hospitalization and prevent severe disease by more than 90%. And they are known to prevent death by 100%. So, and this was noted all across, like regardless of the age, gender, comorbid conditions, and all that. So what it is all these three vaccines have been very effective. And I think as long as we get the opportunity to get any one of those vaccines, we should go ahead and do that.
Thank you, Dr. Sati. Dr. Liang, can you talk a little bit more about the biology of DNA, mRNA, and the difference between the Moderna and Pfizer vaccines compared to the Johnson & Johnson vaccine?
Sure. Can everybody hear me? Okay.
Yes, we can. Thank you.
Oh, great. Thank you for having me. I'm Dr. Liang. I just want to mention a little bit about my background and before I go into the biology. I'm the medical director of Render 360. It's a department, care management, care coordination department at Render Physicians. We are a relatively new network, ambulatory care network in New York City. We serve about almost 100,000 patients, primarily ethnic Chinese descent. And we are located in primarily the Chinatowns of Brooklyn, Queens, and Manhattan. We started about a year ago and we're rapidly growing. We have had the privilege of serving this primarily immigrant community. And we've administered about over 16,000 COVID-19 vaccines in the last 2.5 months. So we do have experience with this vaccine. As we mentioned, the mRNA vaccines are, this is the first time we've used these vaccines in this way, using this technology. In the past, we used weakened or inactivated germs like a bacteria or viruses to make our vaccines, but this is the first time we're using mRNA. However, it has been studied for several decades, this technology. We've tried to use it for certain conditions like flu and Zika and rabies to see if it can protect us against these particular conditions. But this is the first time we're using it in humans. So they use mRNA, and that stands for messenger RNA. And this is a substance that our bodies make using the genetic code from DNA, our genetic material, and it gives us the instructions on how to synthesize particular proteins. So these viruses actually contain RNA in a coating made of lipid nanoparticles. And so that these can be easily delivered to our cells after injection, and they would merge into our cells and they release the mRNA, and then these provide the instructions to make proteins. So the protein that's made in this case is the COVID-19 surface glycoprotein. It's called a spike protein. And after it's made, it's displayed on our cell surface. And when our immune system sees this spike protein, it recognizes as something foreign that's not naturally occurring in our bodies. And so it will trigger our body to mount an immune response. And the immune response is very complicated, but it entails players like B cells and T cells. And these cells, in turn, the B cells will make antibodies, which are special proteins. And these will help neutralize the virus. So it's basically teaching our bodies how to mount an immune response to this infectious agent so that when we encounter this infectious agent in the future, we will be prepared and we can go ahead and recruit the cells, the killer T cells, helper T cells, B cells in our immune system to fight this infection very efficiently, rapidly, so that it doesn't wreak havoc on our bodies. So the nice thing about these vaccines is that we learn how to attack this virus without it causing serious consequences, without getting sick ourselves from COVID-19. So that is how these mRNA vaccines, the Moderna and the Pfizer, work. Now, the Johnson & Johnson vaccine is different. It uses a viral vector, as Dr. Sati mentioned. It actually contains a piece of the COVID-19 DNA, and it's housed in this vehicle called a viral vector. And the particular vector is called an adenovirus. And it is also injected, and it also merges with our cells, and it releases the DNA, which it becomes translated to mRNA, which gets, information is used to make proteins. And the protein, again, is the spike protein, which is again displayed in our cell surface, and again, lets the body know that there's an infectious agent that's new in our body, and that it, again, recruits all the important immune players that we need. So again, it's teaching our body how to prepare for this infectious agent in the future, if and when we actually see it in the future. So I just want to let everybody know that this technology is also not new. We've been using it for the Ebola virus, and that has actually been made using the Johnson & Johnson technology, using a viral vector. And it's been administered to hundreds of thousands of people already in Africa against Ebola, particularly in Guinea and the Democratic Republic of Congo, to protect these people, control the outbreaks of Ebola, and that's included pregnant women and children. So the nice thing about these vaccines is that it gives us the opportunity to protect ourselves against these very serious diseases without coming down with the serious signs and symptoms of these diseases themselves.
Great, thank you so much, Dr. Leong. And a couple of important things too is that, one, none of the vaccines give you COVID, right? So that's one important myth that we need to dispel. But two, especially with the mRNA vaccine, is that the mRNA, once it doesn't interfere at all with your DNA. Can you speak a little bit more about that too? Just some people worried about it's going to interfere with my DNA, and that's not the case, correct?
Correct. So we believe that these COVID-19 vaccines are safe because they do not contain live virus. They do not affect our DNA. They do not interact with our DNA. They do not integrate in our DNA. Once our cells use the DNA or mRNA from the vaccine, they use the instructions to make these proteins, the spike protein. Our cells will break down the DNA and mRNA from these vaccines. So as a result, we believe that they're safe. The FDA and CDC continuously monitor the data from patients that are vaccinated. They've studied very closely the data from the clinical trials. There's ongoing monitoring. There's the V-Safe, there's VAERS. So there's constant monitoring for safety. And right now, as all the data have shown, after 80 million doses have been administered in the United States, we believe that these vaccines are safe and effective.
Thank you so much. And I'll turn to Dr. Chaudhry to talk about just the studies that you brought up. Some people question, well, this was done so quickly, the COVID virus attacked us last year. So how were these vaccines developed within a year so fast in warp speed? Is that alone make people worried about the safety of it? Can you talk a little bit more about that, Dr. Chaudhry?
Yes, sure. Thank you, Dr. Albrutus. And so my colleagues, Dr. Sati and Dr. Park, have addressed some of the biology and how what constitutes these vaccines. The concerns of the communities are very valid because there is a science community, researchers, and then there are community members. And we have to make sure that the community takes that responsibility of getting the right information, and the medical professionals, the scientists, and the researchers, they are engaging themselves with the community to provide them with the right information. So thank you so much for providing this forum and this platform to discuss this. So as I said, the concerns are valid. And however, we have to be very cognizant of the fact that we do not get into a state of analysis paralysis. So there's so much information out there. The focus is the pandemic, rightly so, and lack of information, fear, worry, paranoia, history of distrust. They all lean into a state of analysis paralysis. On the part of communities and scientific personnel also. Just to name a few, does it affect my DNA? And Dr. Park responded to that. Then what are the side effects of vaccination? Then how did these vaccines develop so fast? So it's very interesting that, and throughout the pandemic, there are a lot of scientific terms and non-scientific terms that we are becoming very aware of. Phase 1 trial, phase 2 trial, phase 3 trial, what does that mean? What is FDA? People are more aware of CDC, FDA, but what does an approval of a vaccination or medication means by the FDA? So all these vaccines, the COVID vaccines, they have been rigorously tested for safety before they are being authorized to use in the United States. That's a very important point to understand. The other thing is that it's not just that somebody develops a vaccine and then it's rolled out to the communities. There are general stages of development of a vaccine, and then how we introduce those vaccines to the community or medication, but we'll be specific about the vaccine at this time. So at first there's a research stage or the exploratory stage where we try to find out what's going on, how do we develop this certain technique or vaccine, then the preclinical stage. So the research state or the exploratory state and the preclinical state was a process which was not new. And it's also important to understand that the technology itself is not new. The research is not new. This has been about 3 decades that we are familiar with this technology, and we are familiar with this research. So the clinical development of the 3 stages, that's a process in itself. So during phase 1, there are small groups of people who receive the vaccine. Then you advance it to phase 2, then you advance it to phase 3. And at every stage, we monitor the side effects, the effects of the vaccination very, very closely. So I'm going to just close over here, and then if it comes up, I'm happy to address it, anything else. But the 3 vaccines that have been rolled out at US at this time, they are safe, they're effective, and they will save lives. And that's the only way we can get out of this state of pandemic.
Thank you so much, Dr. Chaudhry. And Dr. Park, I want to talk about what happens once you get the vaccine. What do we need to do once we get the vaccine and until we reach herd immunity? And what is herd immunity also?
So that's a good question. I think it's coming up much more now because we are finally able to increase the rollout for the vaccine. So herd immunity is when people are immune either by natural immunity from being infected with the COVID-19 infection, or gain immunity from vaccines. And that's total immunity. And once we reach about 70–90% is what the data is saying, is when we reach herd immunity, when the COVID virus itself has slowed down drastically enough not to affect or create this pandemic. So, and that's our goal. Our goal is to vaccinate enough people in the US, in New York, in Nassau County, and wherever we are at, to 70–90%. So, even when we are vaccinated, especially with the mRNA and now finally with the J&J, the Johnson & Johnson vaccine, we have to understand and be cognizant that what full vaccination is. So all these terms, just like my panelist has been saying, there's all these scientific terms that people are becoming more familiar with. What is full vaccination? And full vaccination is when you do receive the 2 full doses with the Pfizer and the Moderna vaccine. And that's the mRNA vaccines. And usually it's about 2 weeks after the second dose is when you will reach full immunity. With the J&J vaccine, it's a little bit different mechanism, just like Dr. Leong and Dr. Sadi had explained, and it's about 28 days. So it's about a month. So we can't be complacent. We have to still be extra careful with masking and social distancing, and not feel like, oh, I'm immune now. I can go out and do whatever and be complacent. But the idea of still not a lockdown, but being very safe, social distancing, masking, making sure we are still using good hand hygiene is important, because again, after we get vaccinated, we can still spread and contract the virus and still spread it to other folks. And that, especially to our vulnerable population, and that's people who are older, 65 and older, people with other medical issues and diseases. And I think Dr. Chowdhury had also mentioned about, I don't know if she did, but there are certain groups that are now able to be eligible to receive the vaccines. And those are people with medical conditions, people who are pregnant now. And hopefully, just like the governor had said, hopefully, and the president had said that everyone will be eligible, hopefully by May. And the reason why is we want to reach herd immunity. So that way we can really be able to be a little bit more freer. But how to reach that point is not just with the vaccine. We have to also make sure that we are still taking precautions, because if we are becoming more complacent or loosening up those restrictions, we are at risk of losing more patients to the fatality of this COVID virus. And this infection is still dangerous. I work in a hospital in Queens where we were first affected last year. It was a horrible memory. And we are in the second, third wave right now. And we are still seeing a lot of complications from COVID, a lot of deaths from COVID. And these are not just in the older population and not just in those patients who have medical conditions. So that's why it's really important that in order to reach that type of immunity, total immunity, to herd immunity, which is 70–90% of the population being immune from having the COVID infection or becoming vaccinated fully, we have to still make sure that we are decreasing the spread. And in order to decrease the spread, we have to maintain our precautions because it's a balance. And that balance, you know, people have even estimated, there's been news articles. I actually really like this particular article from the New York Times where they compared if we loosened up the restrictions and still increase the vaccination, our herd immunity may be sped up, but we will lose more patients to COVID. So if we are both maintaining really great increase in vaccination and still maintain our precautions, we will still reach herd immunity, total immunity, but also not lose so many patients.
Yeah, and that's so important.
Really important.
Yeah, and that's so important, not to lose as many patients as we did last year. Last year was just horrific. And kind of shifting gears and talking about if you were to get COVID, thankfully there's been some advancement in the treatment options, especially outpatient treatment options for those who are sick with COVID. Dr. Sati, can you talk a little bit more about those outpatient treatment options?
Yes. So basically, now that, you know, we have come this far, thank God we have a lot of options in terms of, you know, in terms of prevention and treatment. And, you know, it's important that people should know that, you know, everybody tells them that, you know, once you get COVID, you just stay home, take Tylenol, and, you know, you monitor, and if your oxygen drops, then you go to the hospital. But the good thing is now we have treatments which are also available for people who are high risk, means that they have a risk of progressing to severe disease and hospitalization. And there are treatments for that. So if somebody gets COVID and if they are in this high risk category, they should definitely contact their doctors. And there is treatment called monoclonal antibody. I'm sure a lot of people have heard about it. So those monoclonal antibodies, these are used for people who have mild, you know, who are asymptomatic to have mild disease, but if they're in high risk category, like if they are 65 years and older, or if they are, you know, adult or even in pediatric population over 12 years, it's approved. If they have chronic lung conditions, if they are diabetic, if they're 55 and older, and if they have high blood pressure, they have heart disease, if they have any immune suppressing condition, if they are on immune suppressing medications like steroids or chemotherapy medicines, these people are eligible to get monoclonal antibody. And this really works better if it's given sooner into the infection. Like people, you know, shouldn't wait to get sicker. If you test positive and your oxygen requirement is good, you're not requiring oxygen, then monoclonal antibody and is given in an outpatient setting. A lot of hospitals are doing it in their emergency rooms, or there are infusion centers where this is being given. And it's definitely proven to be very effective in preventing hospitalizations and deaths. So this is very good that we should, you know, people should know about that.
Thank you so much, Dr. Sati. And switching back to the vaccine, some people have been concerned about the side effects of the vaccine. Dr. Leong, can you talk a little bit more about the side effects, adverse reactions that some people are experiencing? I know there's some common side effects and there are some that are not as common, but people tend to worry about the most. Talk a little bit more about that.
Sure. So when our bodies respond to a vaccine, we can experience different types of possible side effects. And there are some that are called local reactions, which are really just, you know, arm pain, swelling, and redness. And then there are also systemic or more generalized side effects, which include fever, chills, headache, muscle pain, fatigue, sometimes joint pain, or nausea. And if you experience these side effects, that's expected, it's normal. It shows that you're mounting an immune response to the vaccine and that the vaccine is working. So if you receive the vaccine, you could experience these side effects within 1 to 2 days, up to 7 days after receiving the vaccine. And they're usually mild to moderate, and they usually resolve within a few days. Tylenol can help. Now, these side effects are more common in people under age 60, less common in older adults, but they're expected. And as we also know, there are something called allergic reactions. And this is when your body kind of overreacts to a harmless substance called an allergen. And so sometimes, we will respond by having rashes, which can be treated with antihistamines, like diphenhydramine. And so that can help treat the rashes. And then in very rare situations, there's something the most serious allergic reaction is called anaphylaxis. And that's when the immune system overreacts to a very large degree. And there may be runaway inflammation and swelling of certain tissues. And then people can experience respiratory distress. They can have more generalized hives, rashes. Their blood pressure can drop. Their airway can close. And those side effects, that reaction is extremely rare. And we know that from the Pfizer and Moderna experience that we don't see that more than 2 to 5 cases out of a million doses administered. So those are extremely rare, and there's a treatment where we can administer epinephrine to those patients that develop anaphylaxis and potentially and help in those severe situations. So these are the side effects that can be expected, the allergic reactions and anaphylaxis. And we've seen them, we expect them, and these side effects have not been reported more than other particular vaccines or anaphylaxis than other vaccines. So we're not seeing more adverse reactions or anaphylaxis. So I think that in terms of risks and benefits, we have all lost patients to COVID. We have all lost staff members to COVID. And we have definitely lost loved ones to COVID. So the risk of severe, serious consequences of COVID infection are very great. Unfortunately, these vaccines are not 100% effective. As Dr. Sati mentioned, the mRNA vaccines are only 94, 95% effective. The Johnson & Johnson vaccine is only 66% effective against lab-confirmed symptomatic COVID. So we have to always be vigilant and protect ourselves. And as Dr. Park mentioned, we still need to wear our masks. We need to wash our hands and socially distance because we don't know if we have that 95% efficacy, or maybe our immune response wasn't as great. And so we're not as fully protected as we hope that we would be. As Dr. Park also mentioned, it can take 2 weeks for our immune system to recruit all those cells and make antibodies and fully protect us. So it's possible to still get COVID after you're vaccinated. So that's why we still also have to be vigilant. And we also are aware that this virus is mutating, that there are new strains that are appearing, and there's a South African variant and a Brazilian variant. And we're learning that these vaccines may be less effective. And so there are ongoing trials to see if we need a third booster of Moderna or if we need another dose of Johnson & Johnson. But some protection is definitely better than no protection, because we have all seen how serious COVID-19 infection can be. So the goal for us as a community is to reach that herd immunity, that 70 to 90% immunization rate that Dr. Park is talking about, so that we protect ourselves and we protect each other, and we don't continue to see all the fatalities, the morbidity that COVID-19 is having on our community.
So well said, Dr. Leong, thank you. One thing I often think about is the very first patient in the United States from Northwell who received the vaccine, that she trusts the science with the vaccine, and she rather trust the vaccine and get the vaccine than get COVID. Because even healthy individuals could get COVID and unfortunately pass away from it. So thank you for that information, Dr. Leong. And one to think about, upcoming, just in future months with holidays approaching. We have Easter, we have other holidays. Dr. Chaudhry, can you talk a little bit more about, what we should make sure we do or don't do with upcoming holidays for all of us, just to make sure that we keep ourselves safe and our families and our community safe.
Great. Dr. Brutus, this is something very important. We have heard Dr. Fauci, we have heard our president, we have heard public health experts, we have heard our physicians and our scientists and researchers. We're not out of this pandemic. And it's extremely important that we understand what my colleagues had mentioned, that we have to maintain, first of all, our goal should be to achieve that herd immunity. Also, while we are on our way to achieving that herd immunity, we can't really let go of our guard. What is our guard at this time? Social distancing, making sure when we are interacting, we are not putting our loved ones and our community in harm's way. We are washing our hands, we are masking as much as possible, we are making sure that we are socially distant. And with the holidays, it's very tough. It has been very tough for whole humanity. People, we have lost, as Dr. Leon said, everybody has lost someone, whether it's a colleague, a loved ones, and it's our responsibility. We have heard it, we have said it, that we are in it together, and we are not going to get out of it unless there is a constant combined community effort. So holidays are coming up. It's the responsibility of places of worship, if these are religious holidays, to make sure that all the mandates are followed, that they are respected, and that even if somebody has gotten the vaccination, a lot of times we need to hear it again and again and from different people. Sometimes we're sick of hearing it from the government officials, or we're sick of hearing it from our physicians and just people from our community. This should be a very loud and clear message, because there's still a lot of vulnerable populations and community members whose safety, health are at stake. So with the holidays coming up, Easter, today was St. Patrick's Day. And then in the month of Ramadan, for the Muslim community, second week of April starts the month of Ramadan, which entails every night a congregational prayer. So I would urge our places of worships, our mosques, to be very careful and to make sure that whatever are the social distancing and mitigating factors, mandates, these are followed up. The other thing is that to my Muslim brothers and sisters, I would also say that during the month of Ramadan, people can't get injections. So that means 3 weeks before Ramadan or 2 weeks before Ramadan, they're not going to get, even if they're eligible, they're not going to get those vaccinations. Please get the vaccinations. So I brought this up to our Health Equity Task Force, and Reverend Felker, Barbara Felker, and Dr. Lopez, they did come back to me with solutions. So there are 2 sites. One is Yankee Stadium, and the other one is Citi Field. They are open 24 hours. So we can absolutely, the Muslim community can get their first vaccination, and then, or don't think that, like, if a large chunk of our population is not getting vaccination, we're not getting that herd immunity. We're not coming out of it as we would like to anticipate and move forward to. So get your first vaccination. Don't worry about your second vaccination. Get in touch with us, Office of Asian American Affairs, or other county offices, or when you go to get your first vaccination, make sure you tell them that my second vaccination has to be during the time, not during the daytime. I need a site appointment, which is open 24 hours. Go at 3 o'clock in the morning when you're not fasting, and get that second dose or the first dose, whatever the eligibility is. So thank you so much for providing me this opportunity to bring out this important aspect of our community health.
Thank you so much. And thank you so much for offering how people could work around those restrictions to make sure that they don't miss out on getting the second shot. So thank you for the information. And Dr. Park, we had such a great comprehensive conversation so far about the vaccine, about outpatient treatment options, but there's some other groups also that tend to worry about whether or not they should get the vaccine. For example, women who are pregnant or thinking about becoming pregnant and worried about the fertility. Today, I was on a call earlier in the day with some team members, and a young man who wants to get the vaccine is worried about his own fertility, whether he'll be able to have babies with his loved one in the future. So can you tell us a little bit more about what has the science shown so far? I know the science is relatively new, and even just the other day, we heard about a mother who gave birth to a newborn who had antibodies for COVID, which is great news to hear. Can you give us a little bit more information about that?
Sure. And yes, I know that we've been talking a lot about older patients and patients who have medical issues. We can't forget about our young mothers or people who are thinking about planning for, expanding their family. So this is a great question. This came up very quickly, and you can see in the time of COVID, the pandemic and the economy the way it is, the number of births have gone down, and we've seen it in the hospitals. We feel it in the community. So there's multiple factors, and this question comes up all the time in all types of communities and religions. So there are three main groups and multiple other organizations. The CDC is the main one, the American College of Obstetrics and Gynecology, the Society of Maternal Fetal Medicine, have all stated they strongly recommend women who are pregnant or thinking about becoming pregnant to receive the vaccine. And as you know, the eligibility criteria did open up to pregnant women too. And it's really important. And they recommend all three now. Initially, it was first Pfizer and the Moderna vaccine, but also with currently the J&J vaccine. Because the COVID infection is potentially dangerous. It is going to can cause severe complications and even death. And even though, so we all know that, but although the actual risk is low in pregnant women, those who do get the infection are still at higher risk than those who are not pregnant for hospitalization, ICU stays, higher level of care, risk of dying, and even increasing the risk of premature birth. And we've had a couple of patients who are pregnant, and unfortunately there were complications with the mom, and they did end up losing the baby. And this is reported throughout Northwell Health, and this is why they made a very strong statement from the beginning that it is much safer for the mother and for the fetus baby to receive the vaccine when available as soon as possible. The idea of even birth defects is something that was of concern. And so far, there have been no birth defects that has been noted currently. There are, ever since we started vaccinating pregnant women or who became pregnant, even in the trials and currently now, there has been no instances of birth defects. And no effects. Another thing that you talked about fertility was that there were no signs of or effect of fertility in the animal studies in the mRNA study, and also for the Johnson & Johnson. And just remember, when people are thinking about getting the injection, and just like Dr. Leong said, when you do get the mRNA vaccine, that piece of protein is pretty much gone within hours and days. It does not cross the placenta. Same thing for the Johnson & Johnson. It quickly clears from the site, from the injection site, and they cannot replicate. So they will not cross the placenta. So the placenta is where, the barrier is between the mom and the fetus and the baby. So, and also another important thing is that similar, the adenovirus like the J&J, they showed no harmful pregnancy outcomes in previous vaccines that were similar to the Johnson & Johnson vaccine. So all in all, it's very safe for women. It's safe for the baby. And, I know that you had mentioned about antibodies. So if you do get the vaccine or even had the COVID infection, what is actually passed through to the baby is the immunity, is the antibodies. There are some of my friends even, and it's been showed in the studies too, that when you're breastfeeding and you get the vaccine, you can pass that immunity to the baby too. And this is why during pregnancy, it's very highly encouraged that you do take the flu vaccine and the Tdap. There's other vaccines that you do take that because that immunity is passed on to the baby and it protects the baby too, even after the baby is born.
Great, great. Thank you so much for the information. And I know that there's a lot of mothers, pregnant women, or women who are planning to become pregnant, really comforted by that information. So thank you.
Oh, I forgot to mention, I'm so sorry. I forgot to mention about fertility. So there's no signs or evidence of affecting fertility, and that's been shown in the animal studies too. And if anything, if you do have the COVID infection, they did find the COVID virus in this sperm cell, in the sperm in men. So if anything, protecting yourself against the COVID infection with the vaccine is actually really, really important for the men. Can't forget about the men.
Exactly. Yes, definitely can't forget about the men. Thank you, Dr. Park. So I know that we had a lot of questions come in prior to tonight's webinar, and so we're going to ask some of those questions that came in prior to the webinar, and then I'm just going to give Farah a heads up. If there's any other questions coming in from the audience, we'll allow for some time for that too. But we'll start with the questions that came in prior to tonight's webinar. And we'll ask the first question to Dr. Park. We'll go back to you, Dr. Park. There were some doctors and other healthcare workers who have voiced concern and doubts about taking the vaccine. Can you explain why?
That's actually a really good question. And I wanted to respond to this question because I do work in a hospital and also a big health system. And we were so excited. We were the first health system received the vaccine shipment with Pfizer in the United States. We even made it, had one of our employees be the first person to receive the vaccine. And so we thought, and because we were so affected from it, as you know, we had thought that we would get almost near 100% vaccination compliance, but surprisingly, within a couple of weeks, we were so busy with our vaccine pods, we didn't see that high rise as we thought we did. And it really made us think, well, like, what's going on? So we did a survey, an internal survey, and asked our employees what happened. We had automatically assumed that they would all be on board with this vaccine. And this is with the Pfizer mRNA vaccine. And it really made us really listen and learn because, even though we were healthcare workers and we were fighting and in it with, taking care of our patients and seeing the horrible effects of it, we are still like human, and we're still human. We still have fears and anxieties and mistrust of that is very reflective of the community's concerns, even though we were in it. And it really showed all the same things that we were talking about with my colleagues about why was it, it was too fast. We don't know about the side effects. I want to see, how other people are getting it, and then I'm going to wait a couple months or a couple weeks. And the other thing, which was surprising, which was noble of them, they said, I already got the infection, I have immunity, save the vaccines for my other colleagues. So that was also surprising. And there's also personal reasons and cultural reasons, and things that, they didn't reveal, but, some of the common concerns that the community had, our staff had. So what do we do with it? And this is, we had to really come up quickly with figuring out how to we dispel some of those, not only misinformation, but some of the fears and the questions that they had. And so our health system really tried to do a lot of education, did rounding, used social media, and really educated our colleagues and empowered them to really engage with each other. And so our vaccination rate doubled, almost tripled within a month or two. So, and that's what we need to continue on doing in the community, because if we could do it within our own health system, we should be able to do that in the community.
It's great to see also that those measures were effective in increasing the vaccination rate. So it's really hopeful for us and the community. And we actually are seeing that shift. I remember I've seen so many polls where in November, hesitancy was at like 60%, but now it's going down to about 40-something%. So these educational webinars and campaign that we have is proving to be effective in getting people vaccinated. So moving on to another question that we received. There are reports, including social media postings, that people have died after taking the vaccine. What were the circumstances surrounding their deaths, and are they related to the vaccine? We'll have Dr. Leong answer this question for us.
So thank you. We appreciate that question. There are definitely concerns about the safety of this vaccine. We do have that the database that's called VAERS, which stands for Vaccine Adverse Event Reporting System. That's a database that's co-managed by the FDA and the CDC, and anybody can report any side effects to this database, and that includes patients, family members, it includes healthcare providers, vaccine manufacturers, and the general public. So if you receive the vaccine and you experience any kind of adverse reaction, you are encouraged to report this to this database. So in our experience so far in the United States, between when we started giving this vaccine in December and up until mid-March, there have been 109 million doses of vaccine administered. And in this setting, there have been less than 2,000 deaths reported through this database in vaccine recipients. And that is 0.0018%. It's a very, very low a number for the amount of deaths reported. And as we all know, there is a background incidence of deaths due to any cause. And so whenever the CDC and FDA receive these reports of deaths, they do an investigation. They go in and they take a look at death certificates, they look at autopsy reports, they look at medical records to try to see if there's any linkage between these deaths that are reported to VAERS and the vaccine itself. And when you look more closely at these reports, you see that these patients had other underlying conditions. They had cardiac disease, they had pneumonia, they had cancer. So it's more likely that they died of these other conditions, which were underlying conditions, than from the vaccine itself. There are other cases where there were no autopsy reports, so we didn't get more information than we wanted to. But based on all available data that we have, all evidence, we cannot find a direct linkage between a death and that it was due to the vaccine. So we still believe that these vaccines are safe, they're effective. We know that our death rate from COVID-19 has been very high in this country. We've seen many, many people die in great numbers. But the amount of death from the vaccines recipients is a very, very low percentage. So, and if you look more closely at the data, there are other causes of death, and you can report to this database regardless of whether or not there is a linkage to the vaccine or not. So even if there's a car accident, after someone got the vaccine, then that could be reported to the database. So there's no linkage that we can find between a vaccine and a death, and that's why we still believe that this is very safe.
Thank you so much, Dr. Leong. And I understand we have a lot of questions coming in from the audience, so we're going to switch from the questions we received earlier to the questions we're receiving now from the audience. Ms. Mazawala, do you want to ask some of the questions that we're receiving from the audience to our panel?
Yes, thank you so much. I have Zainab Obaid, who is a program coordinator for the Office of Asian American Affairs, helping me sift through the questions. The first question we have is, are there more side effects of the one shot of Johnson & Johnson compared to Pfizer or Moderna? Dr. Sati, do you want to answer that one?
Sure, Farah. Actually, Johnson & Johnson has all three vaccines. The common side effects are the fatigue, and body aches and arm soreness. And these are the ones that were noted with Johnson & Johnson vaccine. The anaphylaxis or the allergic reaction that was mentioned by Dr. Leong and Dr. Park was mostly seen with messenger RNA vaccines. So far as we know, there are very little side effects with the Johnson & Johnson vaccine. But the common side effects that you will see, which is basically, it's not even a side effect, it's your body's immune system that is reacting. You'll get, people get fever, fatigue, body aches, and you will see with all the vaccines.
The next question is, when will kids be able to get the vaccine? Dr. Park, would you be able to answer that?
Yes, I know that, we can't forget our young people, our little people. So they are starting to do the enrollment. They're asking for people to enroll. And again, because they're young, it's going to be a lot longer and we want to be extra careful. So I don't really know when. I doubt that it's going to be in time for the summer and before the fall, when school will start again in the fall. But hopefully it will be soon enough, and because we do need to have a certain number of patients to do the trial well enough. And we have to be understanding that they're younger, their immune system is a little bit different than adults, even older adults. So their scheduling is something to be considered. So from what I've heard so far, it might be not until the end of the year.
So the next question is a two-part question, and it's a little difficult, so I'll leave it up to any of the panelists to answer. It says, can you discuss more on the status of the different variants of the COVID virus, and also how well is the vaccine working against these variants?
I can start off, and then any of my colleagues can pitch in on that. Having a variant strain is not something new. We have dealt with vaccination, and we have hit successes with vaccinations, and there has been variants. So when we talk specifically about COVID-19, the variants are there. That's how viruses live, survive. That's a mechanism of their own survival that helps them sustain a life for themselves. So now what happens to us humans? So now these variants are not going to go away. We're going to keep seeing these variants because this is the behavior of viruses, they mutate. The COVID vaccination basically helps us decrease or eliminate the severity of the disease. So as we are going to get more familiar with various strains, various mutations, we will have specific vaccinations for them. But for now, the variants are there, the vaccination is there, and the vaccination will help us save lives and help in decreasing the severity of the infection.
Thank you, Dr. Chaudhary. Does anyone want to add to that?
Yeah, I would like to add a little bit. Thank you, Dr. Chaudhary. You said it very right. But what I would like to add, like the thing is, viruses mutate, and they mutate by multiplication. And the more COVID is around us, and the virus will keep spreading and multiplying, we will have more and more variants. So the solution to stop these variants is the vaccination, basically. In terms of these vaccines, they all are not 100% effective anyway, but they're not 100% effective for these variants, but they still do offer enough protection to prevent hospitalization and deaths. And the Moderna already has started looking into it, and Pfizer, it's possible that we may need a booster in future if these variants keep evolving. As so far we know of the UK variant, there's a South African, there's a Brazilian variant, and they are already seeing some variants new variants, which are US variants in California and New York. So vaccination is the solution.
Dr. Chaudhary, if two people are vaccinated, can they interact without a mask?
Yes, they can. So, but then again, it's very, so they will not have this, however, they can transmit. So we have to be very careful within a house. If a household has family members have gotten it or the vaccination, they can absolutely interact. But we have to understand that since the infection is prevalent outside, we do interact with people. So we are still trying to understand the effects and the longevity of the vaccination and the immunity. So we still have to be very careful. I'm very cautious whenever this question is asked. I'm very orthodox in my approach in this. I would say the best solution is to maintain a level of vigilance and to still be very careful, because if you're interacting with somebody who hasn't, or if you have interacted, you're safe, but you can absolutely pass it on.
Dr. Leon, I just have one more question for you. Do you think that we will need to get a vaccine shot annually like we do for the flu shot?
Well, unfortunately, that may be the case because, as my colleagues, Dr. Chowdhury and Dr. Sati alluded to, there is plenty of mutations happening. And the longer that we allow this virus to exist in our population, the more mutations there will be. As I mentioned, the mRNA codes for this spike protein, and this virus is starting to show mutations in the spike protein. And so the antibodies that our immune system are making are going to be less effective in neutralizing this virus. So I hope we don't get there. I hope that we can eradicate it and that we won't need an annual vaccine to control it, which will address the variants that we think will most likely be prevalent in the community at the time that we're vaccinating. But if we do not control this pandemic, if we do not reach herd immunity that my colleague, Dr. Park, mentioned, then we are running the risk of where we will have to get an annual vaccine to try to address those variants that we think will be most prevalent during that season, that year. Thank you.
Thank you so much. Now, the next question, I'm going to try to simplify it. This constituent had a question that they had a severe reaction to the first dose of the Pfizer vaccine, and they've heard that usually the second dose is more severe in reaction than the first. So if her reaction for the first dose was severe, does that mean that her second dose will be extremely severe, or is there a chance that maybe she won't have a severe reaction for the second dose?
So I'm going to answer that because I personally had that same scenario. So I took the Pfizer vaccine. I had really uncomfortable, very, I'm going to be completely honest, it was awful. I got it on a Thursday thinking that I'll be a little off on a Friday and leave work a little early. But I had very sore arms pretty much starting that night, and the next day, fevers, muscle aches. I felt off, all I want to do is crawl into bed. And because I've heard that the vaccine is going to be worse, I was very fearful. My symptoms after the first one pretty much resolved after 48 hours, and I was very thankful. I think I did take a Tylenol at that time. So I was really worried, I was concerned. And because we were one of the first people to get it, I couldn't, compare it with other people. There was not too many other people to compare and ask about. But the second one, it was much milder. And maybe a little bit of soreness in the arm, maybe a little achiness, but much better. So I think I think whichever order it happens, I think it'll be fine. And different members of my family had different variations. So every person is going to be different. I think the precautions are there just to make sure that it's not so alarming. When Dr. Leong and Dr. Sadi had explained about the side effects, it's just there. So it's very helpful that we are as honest as possible when we're doing the education. So it's not out of the ordinary. But yes, that was my concern as well.
Thank you so much for the answer. So many people are asking questions about the new vaccination sites and when they will open. I asked them, and Dr. Albrutis, you can add to this, is that they could check the county executive's Facebook page or the social media. They could check our social media. Zainab will put a link to our office's Facebook page and a link to our website and our number. So if anybody has any questions and they need access for language access for Mandarin, Urdu, Hindi, Bangla, and Arabic, they can reach out to us. Also, if they want to sign up for the SMS texting services, that's an amazing way to get the up-to-date information on the vaccine. If any of the sites are opening up, they have been posting that on the SMS texting services. And you could also join our WhatsApp groups and WeChat groups for the Office of Asian American Affairs. Dr. Albrightis, did you want to add anything?
Yeah, I'll just add that also the Department of Health, Nassau County Department of Health also is a great resource for that information. You can often find information about when the latest sites are opening up, and also links and phone numbers to make an appointment to get the vaccine. And also, as the county executive mentioned earlier in our webinar, that there's now a new call center for seniors. I'm trying to identify, trying to get the phone number once again so we can repeat the phone number for the call center so that those are interested in getting assistance in getting the vaccine. If they're a senior, we could provide that phone number. I'm just going to look for it one more time, and we could repeat it.
Okay, great. And, I do want to close it off as we have gone over our time of 7 o'clock. I want to tell everybody we are so grateful for you to tune in, and we are so grateful to the panelists who took out their valuable time to give us this information. I actually learned a lot, and I was taking copious notes on this. So thank you so much for sharing your valuable time with us. Thank you.
Thank you so much. Also, I also want to thank you all on behalf of the Office of Health Equity. We really appreciate this wonderful webinar and taking the time out to be on the webinar. And we're going to do another webinar next week with our Haitian American community. And in a few weeks, we're going to do another one targeting our Latinx community, which will be done in Spanish. So please look out for flyers about and postings about those two webinars. So thank you once again for your time and attention. And we wish you all the best, and we hope all of you stay safe and